So today we're going to go through a lot of the basics about lymphedema, as well as kind of what to watch for if you're at risk for lymphedema, what to do if you develop any signs and symptoms, and kind of some things to help reduce your risk of lymphedema. Alrighty, so next section is basically saying, okay, so if a person is at risk for lymphedema, they've had surgery, they've had radiation, but they aren't showing any signs or symptoms yet, what can that person do to minimize the chances of them getting lymphedema? So the first thing we talk about is skincare, because we do want to prevent any kind of infection. Now, I will say when I teach people these things, when they come in to see me, I do tell them there is a fine line between scaring people and educating people. They read some of this stuff and they're like, oh my gosh, this is a lot. But I tell people, you still need to live your life. You are going to get cuts and bruises and scratches on your at-risk side. That's fine. It's just knowing what to do about it. So it talks about if you're going to be working outside, wear gloves so you don't get scratched if you can help it. Wear bug spray, wear sunscreen, anything to protect your skin. Most people have heard the don't get blood draws, blood pressures, things like that, injections on their at-risk side. That's pretty common. They make cute little medical alert bracelets now that say like at-risk limb that you can get to make sure. I did have a woman who was always very careful about not getting any of that done on her at-risk side. And she had a medical emergency and was home alone, and they called an ambulance. And when the ambulance arrived, no other family members were there to tell them not to use that side. And so they did a bunch of work on her at-risk side because they were worried about her safety. And she ended up developing lymphedema as a side effect of that. So I will say, I had a nurse at a doctor's appointment recently go to take my blood pressure, and she specifically said, have you ever had breast cancer on this side? And I was like, oh no, but I love that you just asked that, because I feel like they don't ask that very often. And then if scratches do occur, just keep them clean, keep them covered. If there's any signs of infection, redness, anything like that, you might want to let your doctor know, because some of them will be very proactive in prescribing something to prevent an infection if they know you're at risk for lymphedema. Yes, Judy?
I'm sorry, I don't mean to dominate, but as I said, I'm a 27-year survivor and I've had a right mastectomy. Does that guideline to not allow injections, blood draws, or blood pressure on my right arm ever change? Or, I mean, at 27 years, I still don't allow anybody to do anything with my right arm.
I would feel the same way. I don't think I've never read anything that says there's a point in time where that precaution goes away. And, I tell people, you have two arms, you might as well just make them use the other one. But yeah, and I will be honest, I tend to be probably overly cautious when I educate people, because I mean, if it's as simple as not having a blood pressure drawn on that arm, I tell them to really try to avoid that as much as they can. But yeah, I usually say that's forever. Yep.
Okay, thank you.
So other risk reduction techniques, avoid anything real compressive. Now, this is kind of feels a little off, because we tell people to wear a compression sleeve and then we say don't wear anything too tight on your arm. So compression sleeves are different because they're well-fitting, they're made to work in a certain way. This is more, we try to tell people on your at-risk side, don't wear clothes that have like tight cuffs, like a elastic band at the bottom of the pant leg or the sleeve. I frequently tell my younger patients, especially, not to wear ponytail holders on their wrist, because a lot of them do that. So I ask them to wear that on the other side. We're going to talk a little bit more about both exercise and air travel here in a minute, so I'm not going to go into deep detail there. We always teach about signs of infection because it is so important. Sometimes a person can get an infection in their at-risk side, their arm or their leg, and that is what triggers their lymphedema. Because when we have an infection, our body naturally sends more fluid to that area. It's kind of that inflammatory response. And then sometimes that affected extremity that has a damaged lymphatic system, all of a sudden it can't keep up and it can't catch back up with that fluid. And then that fluid just stays and it stays swollen. So redness, swelling, that skin is warm or hot to the touch. If it's painful, some people just don't feel well, they have a flu, those kind of things. We tell them just to be on the lookout and notify their doctor if they think they have an infection. So air travel, it's kind of a hot topic. The National Lymphedema Network is a website that we frequently refer people to if they like to Google and they want good, solid information. They do what are called position papers, where they talk about things like air travel, like what they go through all the research and they make a decision based on what all the research says. So their newest position paper says, if you have lymphedema, you should definitely wear a compression sleeve or stocking or whatever when you fly. They used to always say that if you were at risk, you should as well. Now they've kind of backtracked and said, well, you should decide for yourself if you think you need to wear one if you're at risk. I'll be honest, this is where I tend to be overly cautious and tell my patients, if it was me and all I had to do to potentially prevent something happening is to wear a compression sleeve, and typically you put it on like an hour or so before you get on the plane, then you leave it on for an hour or two after you get off the plane at your destination. You don't have to wear it the whole time you're on your vacation or wherever you're going. But if I was at risk and was like, yeah, I'm not going to do that, and then I developed some swelling, I think I'd be really frustrated with myself for not doing it. So it's a pretty simple way to potentially prevent something from happening. So I am a big proponent of this. But it is something that if someone really feels strongly about not wearing one, then they don't have to. So compression stockings and sleeves should fit well. I tell my patients they should be comfortably snug. They need to be snug to do their job. They shouldn't be sliding down on your arm or your leg. I get patients who say, oh yeah, I just went and bought one myself. And I'll ask them how they knew what size to get. And they'll say, oh, it was based on my shoe size, like for a stocking. And we really like the ones that require some extra measuring. It's only 3 or 4 measurements, but it really ensures a good fit. The nice thing about compression in today's world is that the companies that make compression garments are really great about making a wide variety of sizes. And so it's much easier to find one that fits almost anyone now than it used to be. Judy?
Brenda, I'm sorry, but have another question about the compression garments. Do people
Sure.
need a prescription for a compression sleeve or stocking? And is that something insurance will help cover?
So it kind of depends. Medicare typically will not pay for compression sleeves or stockings, which people have really been trying to lobby and get them to help pay for those. If you're going to go buy it yourself and it's just off the shelf, you're going to walk in somewhere and buy it, you typically do not need a prescription. If your insurance company is going to help pay for it, then yes, they typically require a prescription. I have a hard time remembering which insurances cover it and which don't. And even within like Blue Cross and Blue Shield, some plans do, some plans don't. So I usually tell my patients to call and ask, the worst they can do is say no. And then if they say, yes, we'll cover it, then I usually help facilitate getting the prescription from the doctor because I'm not allowed to write those, and help them, from that standpoint.
Thank you.
Yeah. Yep. Exercise and lymphedema. So remedial exercises is part of what we do during our treatment, and they're just very basic exercises. You're just moving a body part. And the movement creates kind of a pump of that muscle and helps facilitate that fluid to move. Flexibility and stretching exercises, people who have a lot of tightness post-radiation and things, they might have scars or fibrosis from radiation that's actually inhibiting the fluid to flow. So doing some stretches can help improve the lymphedema as well as just making someone feel better and being able to move a little bit better. Resistance exercise is where a lot of research has been done related to lymphedema in the past several years. There was a point in time years ago, they would be like, oh, if you have lymphedema or you're at risk, you should not be doing aggressive exercises, weightlifting, intense exercise. That's kind of all gone out the window. There's been enough research done now that's saying it's perfectly safe. If someone wears a compression sleeve normally, they should absolutely be wearing it while they're exercising. We just encourage people when they're getting back into exercising right after their treatments, they can't just jump back into what they did before. They have to start slowly, work up as far as level of weights they're using, the repetitions they're doing, the amount of time they're exercising. And then we just teach them having a slight increase in what feels like swelling in that side after your exercise is okay and normal, as long as it goes back down within 24, 48 hours. And it shouldn't be anything significant. So I usually tell people, do the same weights or the same repetitions for a week or two. As long as everything stays stable, then bump it up and kind of go from there. Aerobic exercise is perfectly great. The better health overall someone is, then, the better they're going to feel, and it's going to help with their lymphedema. There is a study that said that individuals who performed aerobic exercises and weightlifting actually controlled their lymphedema better. And so exercise is considered perfectly safe and beneficial for people who both have lymphedema or are just at risk. And again, it's just monitoring how you feel afterwards and just taking it slowly. It's really hard when we have patients who were super active before. It's hard for them to start back kind of at ground zero again, but we give them a lot of guidance. We have a physical therapist that works with us, and she works a lot with fatigue and just overall strength and conditioning. And she gives them a lot of really great guidelines as far as heart rate, zones and things like that. So it's just a matter of progressing slowly. So these are local to Kansas City kind of things. I know that the Live Strong at YMCA, I don't know, I think it's kind of a nationwide thing. I have had some patients recently who took those classes and really, really enjoyed it. It kind of gives them a structured way to get back into some exercise. It also is a group of other cancer survivors. So that sometimes is great to have other people who understand what you're going through. And then a couple local places here in Kansas City are Gilda's Club and Turning Point. I know that some of their classes and things have been very different because of COVID. So I'm not sure what they're doing right now, but kind of good places. They do some yoga classes and various things that people can get involved in as well. And then I always put these in here. We get a lot of people who come in and they like to Google and they like to look up information. And you can find a lot of really scary stuff about lymphedema on the internet if you just do a random search. So two of the places that we like to direct people, there's the National Lymphedema Network, and then also the Lymphedema Education and Research Network. And they are both, the content is done by medical professionals. It's based on research and it's really good, relevant information. So that's usually where I direct people if they would like some more information. So. Alrighty, I think that is it. Any more questions? I have a lady I've taken care of a couple times over the years who was very, very active and had a recurrence of her cancer recently. And she got involved with Live Strong at the Y because she really wanted some guidance, and she has absolutely loved it. She said it's been very beneficial for her.
Well, Erin provided some pretty impressive data about people's satisfaction and the changes in their abilities through the program.
Yeah,
it's impressive.
Amazing. Yes. Yep.
Any questions from anyone else?
Brenda, it's great to hear from you again.
Hi, Karen. It's good to see you.
Hi, nice to see you. Yeah, you've done a great job again today.
Thank you.
It's always, and it's good reminders for me, because I work with a lot of breast cancer survivors. So just kind of hearing it again, I'm like, okay, I need to remember some of these things for the women that I work with. So thank you.
Absolutely.
Now, by all means, jump in and ask Brenda questions. You have the expert here today. We don't always have access to somebody with all the specialized training that Brenda has.
Well, here's the question. So let's say that there's a person who doesn't have access to a certified lymphedema therapist, either because of geography or insurance or just for whatever reason, right? Like they just say, like, there's nobody in my area that I am able to have access to. What's the next best option? Like, would you suggest massage therapy, or would you suggest just OT, and like a general OT, even if they weren't certified, would have enough knowledge? Do you have a sense of that?
I would say I would look into a massage therapist, because there are massage therapists who do have training in doing lymphatic massages. I have some patients who, once their insurance, like from a medical standpoint, they really don't qualify to continue seeing me, they will go, pay a massage therapist to do the lymphatic massages. The other maybe benefit of COVID has been telehealth has become quite a big thing. And like, I know that for our facility, I'm trained to do telehealth. And so at least if you could do that just a session or two, just to kind of get some information and things
Good
might
point.
be beneficial too.
Mhm, mhm.
Yeah.
Yeah, that's a really good point. I hadn't even thought about that you would be doing some of your work by telehealth. So that's great.
It's challenging because so much of it is
Sure.
hands-on, but it's better than nothing. So yeah.
Absolutely. Absolutely. That's great. Thank you so much.